Hello, everybody, and welcome to this webinar. Thank you for joining Dr. Kunal and myself, Robiha. I am your host today. I am a dental hygienist and a customer success manager here at Pearl. We are going to talk you through how to harness the power of AI for better precision, efficiency, and patient care. So what I will do is pass it over to Kunal, who has kindly joined us. Thank you, Kunal, for joining me. I
Thank
can't
you for
wait
having
to
me.
hear what you're going to share. So I'll pass it over to you.
Okay. Good evening, guys. So, my name is Dr. Kunal Rai, and today I'll be talking about harnessing the power of AI for better precision, efficiency, and patient care. So, in no particular order, I would like to give you an insight into Pearl Second Opinion, go through a few case examples of radiographic analysis, give you a quick tour of how Second Opinion works, and how Second Opinion has elevated my clinical and operational efficiency. So I'll start off by introducing myself. My name is Dr. Kunal Rai. In terms of education, I graduated from Charles University in Prague in 2015. Since then, I've done an MSc in dental implantology with distinction from Manchester. I've done a PG diploma in restorative dentistry and a PG diploma in clear aligner therapy. To complement my dental implant work, I've done a PG certification in oral surgery. I'm a general dental practitioner and practice owner, and I'll talk about my practice shortly. When I'm not in practice, I run a one-to-one mentoring course helping fellow dentists with their clear aligner cases and to set it up and to get the best outcome for their patients. In terms of awards, I have won the ADA Clinical Case of the Year award in 2022, and I'm shortlisted finalist for the Case of the Year 2024, which I believe we get told in February this year about the winner. In terms of finalists, I'm also a Young Dentist finalist in the year 2020 and 2021. Entrepreneurship, I'm a co-founder for a clear aligner system called Aligner. I'm a key opinion leader for Tokiyama and Zima Dental. In terms of charity, we donate a percentage of our profit to Wells on Wheel as Shaz initiative, where I personally provide the kids with school uniform, books, and everything school related. In terms of social media, we do post cases online. My personal professional account is Kunal Rai underscore dentistry, and for the practice, it's Meliora underscore dental. Moving on. So when I'm not in practice, I'm basically working on focusing on the Aligner brand. I'm also a big advocate of digital and AI dentistry. The middle slide that you can see here, this is me talking at Leeds University about why we should work with digitally, why we should do digital dentistry. The slide over here is me last year talking in November last year talking about AI, why as a dentist we should embrace it and not be afraid. So the practice itself, the practice is called Meliora Dental. The word Meliora is a Latin word for above and beyond. The practice I inherited has been established for over 20 years and used to be trade under the name Roundhay Road Dental Practice. And as you can tell from the name, it's located in Roundhay Road, which is in Leeds LS8 area. The practice used to do the basic bread and butter of dentistry, doing a lot of assessments, a lot of silver fillings, and extractions with plenty of plastic teeth. Over the last 24 months, I qualified in 2015, as mentioned. Then I did my VT in Bridlington. And thereafter, I worked for 7 years for Bupa. And in 2022, I decided that I'm going to take the plunge and move to practice ownership. That's when I signed up to Christie's Dental Lead, and I was introduced to Roundhay Road Dental Practice in May. I placed an offer in June 2022, which got accepted, and in February 2023 that's when we moved in. And this is what I acquired. A black and white looking exterior and bizarre looking black and white walls with some random red chairs, which I can assure you we have got rid of. Over the last 24 months, I have invested heavily into the practice so we can provide advanced treatment to our patient, improve patient journey and communication. We've also introduced various new tools, software, and one of the applications that has helped me to move from 100% national health to a mixed practice has been Pearl. And I'll talk to you about how Pearl has helped me personally to enhance, to advance my practice. So this is a practice today. So we do a lot of clear aligner cases, a lot of smile makeover. And that's Lily, who's just finished her treatment, and we've just, as a thank you, we're giving her a flower and a bunch of chocolates. So this was the practice when I bought it, and this is the practice today. Moving on. So an introduction to second opinion. Second opinion is essentially an AI tool that has been developed by Pearl. Second opinion is the first clinical AI diagnostic tool that has been deemed safe and effective by the FDA. To my associates, to my staff, I say to use this tool as a second set of eye that can help with decision making and communication. It is a real-time radiographic analysis that can help to detect certain anatomies, cavities, pathologies, bone loss, and so on. So why did I choose AI radiographic tool? This all stems back to my time as a VT trainer. I base training this basically. So I was working in Bridlington. In second month of my training, I saw a patient over lunchtime, Mark, and I did his report, and I basically was doing his report over lunchtime. I identified the upper right 4, upper right 5 for a filling. And over lunchtime, Dr. Mitesh, who recently qualified, came to my surgery to go for lunch. I started discussing this case with him. And he said, Kunal, I will do the upper right 4, as you identified, but also do the lower left 7, DO, because there was a bit of a shadow in there. Seeing us having a conversation, Dr. Katrina, as it was lunchtime, Dr. Katrina, a qualified dentist working in the practice for over 5, 7 years, she came to our room and we started having a chit chat. And I asked her opinion on this X-ray, and she said, "I'll do the upper right 4, as you said, but I would do the lower right 6." So in the span of 20 minutes, three dentists within the same practice gave three different treatment options for this same patient. Subsequently, I spoke to my trainer, Dr. Kowalczyk, and I asked for his advice. And he just suggested just to do the upper right 4. So overall, in a half a day span, I had four dentists, same practice, giving four different treatment plans. Now imagine if you were this patient and you went to see all four dentists, you would be damn confused. Who do I believe? They've all given me different treatment plans. So from that moment of time, I knew when the time comes and I have my own practice, I will not have my patient walking out confused. The time came, February 2023. This deal went through. I started looking into softwares. I started looking into tools, and I had a demonstration for second opinion. And from that moment of time, I was completely blown away with this software. I knew if I do not have this software in my practice, I will not be doing justice to my patient. So I sat down with Jack, we discussed numbers, we agreed on a price, and the installation just literally took a few days, and it happened in the background with the IT team. Everything was done. Then Robiha kindly came over lunchtime, virtually gave us a demonstration. And since then, we have not looked back as a team, and we use this tool for both our NHS as well as private patients. Okay. So in a chronological order, I'm basically going to talk you through what I've done so far. So when I qualified, I basically used to spend a bit of time using the magnification glass on the exact tool to look into teeth, see where caries are, and then I would present it to my patient. And this is what I would present. A black and white image talking about this is your right side, this is your left side. These white blocks that you can see, these are your existing fillings. This appearance is your bone. Can you see this little black shadow there? And 9 out of 10 times, the patient would not have an idea what we're talking about. They will just shake their head and either go to reception, book themselves for a filling, or just pay for the assessment, or even not pay and just walk out and never come back. But one patient basically left as a Google review. He basically said, I came for a checkup, went to see my dentist, a new dentist at the practice. He did a assessment, he took some x-rays and then said, I need to have three fillings. I didn't have any sensitivity, any pain, but he said, I need three fillings. Stay away from this dentist, he's a robbing bastard. So we've had a good and bad. I don't know about you guys, but what I've generally when I just used a black and white image in the daytime, in the morning time, I used to find I was fresh. It didn't take me so long, but in the afternoon, after lunch, I felt a bit tired, and it take me longer to identify things on X-rays. Then came COVID, and it was like a blessing in disguise for me. I didn't spend a lot of money going out, no holiday, so I saved up a bit. As an associate, I then invested into the iTero scanner. So now I'm just going to go through a chronological patient journey. So when I qualified, I used to spend a lot of time looking at a black and white image, depending on the time of the day. If it was morning, relatively quick, but in the afternoon, I used to feel, after lunch especially, I used to feel a bit tired, fatigue kicked in, and I used to spend a lot of time on magnification glass, making sure I'm not missing anything out. And I was always running late. And I used to show a black and white image to my patients. So I was talking about this is your right side, this is your left side. These white things that you can see, these are your existing fillings. This is your bone structure. Can you see this little bit of shadow here? That's a cavity. And 9 out of 10 times, I would just have the patient nod their head saying that, yeah, that's fine. They would go to reception, book themselves in, not knowing what they're booking themselves in for, or they would go, pay or not even pay, just walk out, but they will always leave a Google review. I had one patient who left us a Google review on the practice website, on the practice Google review. I came to see a new dentist at the practice. He did the checkup. He took some x-rays. On the x-ray, he told me that I need two or three fillings. I have no pain, had no sensitivity. It just feels like he made it up. Stay away from this dentist. And that's what I had. Since then, then in 2020, I invested, COVID came, I invested in an iTero scanner. As you know, we didn't go out, we didn't have any holidays, so saved up a few bucks. And so I invested myself as an associate into an iTero scanner. The primary purpose of the scanner was to do for Invisalign treatment. However, I also used it for my private patients, so we could do a scan, so we can amalgamate it with the X-ray, so to give them a better understanding of what is happening with their teeth. Like in this case, this is the lower arch. We spoke about the patient needing a good clean because of tartar built around. Then we spoke about how there are silver filling. Would the patient like to have this removed for a white filling? Thereafter, we also basically showed these patches over here and with the x-ray and said, these are teeth that have got some cavities and may need some filling. So it was a better communication tool. The biggest breakthrough, and this was Chelsea, sorry, my nurse who used to do my scan for me in Pontefract. She started off 10 minutes per scan, and by the end, she was doing things under 2 minutes. Then the breakthrough happened in 2023. As mentioned earlier, I bought my practice, I installed Pearl, and I no longer show a black and white image to my patient. This is what I show to my patient. And I'm just going to run a video of my communication with the patient. I recorded this over Christmas, so please excuse the Christmas outfit.
In this video, what I'm aiming to do is to give you an insight of how I explain my x-rays to the patient, how I spend less time explaining the x-ray and more time educating the patients. So we took two x-rays for yourself as part of the assessment, one on your right side and one on your left side. This is the black and white image that in the past you would have seen, and I'm not sure if it made sense to you at all. So let's jazz things up. I use Second Opinion, which is a 3D radiographic tool to help us explain your x-ray a bit better. So I'm just going to click on pathology, get that switched on, and tooth part. So this is your top right, this is your bottom right. What we can see here, so if I give you a mirror right now, and if you smile, you can see white surfaces. That white surface that you see is what we call the enamel. And on an x-ray, this is your enamel surface, the outer shell. Under the enamel, we've got some soft areas, which is the green zone. That is your dentin. Then you've got your nerve, which is purple, which provides nutrients and blood supply to your teeth, and that's your root. Between two teeth, you've got the honeycomb periods that you see. These are the bone structure that holds your teeth in place. What we can see here is an existing filling. That's on your back tooth. You have a tooth missing here. Additionally, we can see some green squares. These are where tartar has built up, and I recommend a clean for your teeth. And this generally occurs due to not cleaning interdentally, not using interdental brushes to clean in between your teeth. Now we can see some pink areas. We can see some light pink areas and some dark pink areas, stroke magenta areas. These light pink areas are what we call enamel caries. With a good oral hygiene, with a good diet, you can stop its progression. And in some cases, you can even replenish the lost minerals. However, when this pink area, light pink area, becomes a dark pink magenta area, that's when we recommend a filling. And as we can see here, this has progressed 6% into the green zone, this has progressed 14%, and this has progressed 72%. So this one is quite deep. This potentially may need some invasive treatment. Now let's look at your left side. This is your top left side. This is your bottom left side. We've got existing fillings here. These are between your two premolars. This is the pink area. As mentioned, these are enamel caries. With a good oral hygiene, good diet, you can stop its progression and even replenish the lost minerals. However, on your first big two on the lower left side, you've got a progression into the green zone, becoming a dark magenta, which means I would like to recommend a filling here for yourself. On this too, you've got an existing filling here. Next door to the existing filling on your second premolar, you've got a cavity developing, which is 20% into the green zone. So again, a tooth that I would recommend a filling. All in all, you need 1, 2, 3, 4, 5 teeth that need a filling. And as you came out of the NHS patient, by default, these 5 teeth would be, you will get a silver filling and for under a band 2. However, you can always upgrade it and upgrade it a feet per item, and that is a white filling. And if this was my mouth, I would go for a white filling here because that's in my smile zone. That's again in my smile zone. I wouldn't mind a silver here, but it's completely your choice. Again, I would go for a white and white here because these are the teeth that people will see, and I would definitely like that to be covered up.
Okay, let's move on. So now, let's just spend a few seconds on this X-ray. As clinicians, we can understand what is happening here, but as a patient, they will not. So just to give you a bit of history, this was an NHS patient that came to see me with some excruciating pain on the top right side, which was keeping her awake at nighttime. Symptom-wise, based on the diagnosis, we identified this as acute apical periodontitis, but this is the X-ray that I showed the patient. A colored version and I spoke to her different parts and I explained to her my finding. So what I said to her, the problem that you're having is, can you see this inverted crown over here? That is the infection. That is what's giving you that pain. Now, treatment options here are do nothing, a root canal, or an extraction. Mind you, this patient was an NHS patient and she wanted to save her teeth. And she chose a root canal. Thereafter, I had another conversation with her to explain to her this needs to be a private treatment. So what I did, I went over this premolar and I explained to her, can you see this purple part, which is the nerve? You can see the starting point and you can see the end, which is right at the end of the tooth. Whereas if we look here, we can see the starting point, but it stops halfway, which basically means that the end is not clear. It needs some further work. It needs some extra tool for us to identify that path because it's closed due to calcification. Yes, we can still save the tooth. However, I need to refer you to our specialist who can take care of this, which means that it will be a private treatment. Are you happy with this? Initially, the patient was a bit unhappy, but then over time she understood and we managed to convert it from an NHS treatment to a private treatment. A full mouth X-ray, I normally take this for my clear aligner cases or a patient who comes in for a wisdom tooth. Again, a black and white image, making not a lot of sense to patients. So I convert to jazz this up with some color information. And this is what I display to the patient. This patient came to me with problems with her lower right wisdom tooth, and we can see clearly why.
So I zoomed into it and I explained to her, you've got a line wisdom tooth. Now, this X-ray itself is not, it's just telling us it's very close to the nerve. And if we take this tooth out, there's a risk of damage, permanent damage to your nerve. So I will refer you for a CBCT so we can find out whether this tooth is in front, on, or behind this nerve. And that will dictate how we treat. Okay, so now I would like to give you a quick tour of how second opinion runs. Right, guys, so I'm just going to give you a quick tour of the second opinion software. When you log in the Europe, you need to go on to secondopinion.hellopearl.eu. You will be presented with a homepage displaying all the recent patient files, which contain all their radiographic images that are automatically populated onto the site. Now, as you can see, the homepage layout follows a simple and modern-looking design, with the most recent image set appearing in the top left side, and all the sets arranged in a snake pattern down the page. Each entry displays basic patient information, including name, date of birth, and the number of images in the set. At the moment, a notable feature, PHI, Protected Health Information, is activated, which is located in the top right corner. When activated, it replaces patient's name with asterisk, providing a GDPR-compliant view. I find this quite useful when showing the screen to the patients, so you can hide the patient information and you're not revealing anything. If you need to, you can easily just hover over the asterisk, which can reveal the patient's name. Now, the system attempts to automatically mount images in the correct position within a full mount series. However, as clinicians, we can easily drag and drop images to new position if adjustments are needed. So if I click on rotate, the image can be moved around. Okay. Now, whilst we're here, I'm also going to show you a compare feature. So let's just go on this most recent bite wing. Now I'm going to click compare, and I'm going to compare this March 27, 2024 X-ray with the 7th of July, 2022. So you got X-rays side by side, and you can basically track changes over time. Just keep in mind, the effectiveness will depend on the consistency of the image captured. Okay, so let's move on. Now, before I forget, second opinion relies on images being captured through your regular imaging software and then synced to the platform. As clinicians, we cannot simply upload an image into second opinion for it to read like any other AI software. And currently, it only works with 2D images. Later on in the year, it will start reading 3D images. Okay, let's look at another set of X-rays. Now, what I wanted to show you is how does second opinion report on certain conditions. Let's look at bone measurements. This system provides automated measurements from the crest of the bone to the cement to enamel junction, and they are color-coded in white, yellow, and amber. The range for white is 0 to 2.5 millimeter, yellow is 2.5 to 4 millimeter, and amber is greater than 4 millimeter. So this is amber. Sorry, this is yellow, so greater than 2.5 millimeter and less than 4. Because this is less than 2.5, this is showing in white. I find this feature quite helpful for periodontal assessment. Okay, now let's look at something else. Let's have a look. So this is what the purple square that you can see here. This indicates areas of notable margin, such as potential overhangs or open margin on existing restorations. Now, let's look at something else. Can we see the green square here? This green square highlights area of radiographic calculus, which is useful to hygienists and dentists in treatment planning and patient education. This is self-explanatory. You can see there's an infection here. Let me put on the two-part feature. So any kind of periapical radiolucency will be outlined in blue. Okay, now let's talk about caries. Now, caries is arguably the most well thought out feature. The system uses two shades of pink to indicate potential caries, light pink and dark magenta. The light pink indicates early caries lesion, incipient caries, 100% into the enamel, which in my case, I'll generally just review. The darker magenta, which are caries which are extending into the dentin, and we need to restore it. Another feature that we can see is the percentage breakdown. This system provides a percentage breakdown of enamel versus dentin involvement, which I will talk about later and how it generates revenue for my practice. Right, guys, so I'm just going to give you a quick tour of the second opinion software. When you log in the Europe, you need to go on to secondopinion.hellopearl.eu. You will be presented with the homepage displaying all the recent patient files, which contain all their radiographic images that are automatically populated onto the site. Now, as you can see, the homepage layout follows a simple and modern-looking design, with the most recent image set appearing in the top left side, and all the sets arranged in a snake pattern down the page. Each entry displays basic patient information, including name, date of birth, and the number of images in the set. At the moment, a notable feature, PHI, Protected Health Information, is activated, which is located in the top right corner. When activated, it replaces patient's name with asterisk, providing a GDPR-compliant view. I find this quite useful when showing the screen to the patients, so you can hide the patient information and you're not revealing anything. If you need to, you can easily just hover over the asterisk, which can reveal the patient's name. Now, the system attempts to automatically mount images in the correct position within a full mount series. However, as clinicians, we can easily drag and drop images to new position if adjustments are needed. So if I click on rotate, the image can be moved around. Okay. Now, whilst we're here, I'm also going to show you a compare feature. So let's just go on this most recent bite wing. Now I'm going to click compare, and I'm going to compare this March 27, 2024 X-ray with the 7th of July, 2022. So you got X-rays side by side, and you can basically track changes over time. Just keep in mind, the effectiveness will depend on the consistency of the image captured. Okay, so let's move on. Now, before I forget, second opinion relies on images being captured through your regular imaging software and then synced to the platform. As clinicians, we cannot simply upload an image into second opinion for it to read like any other AI software. And currently, it only works with 2D images. Later on in the year, it will start reading 3D images. Okay, let's look at another set of X-rays. Now, what I wanted to show you is how does second opinion report on certain conditions. Let's look at bone measurements. This system provides automated measurements from the crest of the bone to the cement enamel junction, and they are color-coded in white, yellow, and amber. The range for white is 0 to 2.5 millimeter, yellow is 2.5 to 4 millimeter, and amber is greater than 4 millimeter. So this is amber. Sorry, this is yellow, so greater than 2.5 millimeter and less than 4. Because this is less than 2.5, this is showing in white. I find this feature quite helpful for periodontal assessment. Okay, now let's look at something else. Let's have a look. So this is what the purple square that you can see here. This indicates areas of notable margin, such as potential overhangs or open margin on existing restorations. Now, let's look at something else. Can we see the green square here? This green square highlights area of radiographic calculus, which is useful to hygienists and dentists in treatment planning and patient education. This is self-explanatory. You can see there's an infection here. Let me put on the two-part feature. So any kind of periapical radiolucency will be outlined in blue. Okay, now let's talk about caries. Now, caries is arguably the most well thought out feature. The system uses two shades of pink to indicate potential caries, light pink and dark magenta. The light pink indicates early caries lesion, incipient caries, 100% into the enamel, which in my case, I'll generally just review. The darker magenta, which are caries which are extending into the dentin, and we need to restore it. Another feature that we can see is the percentage breakdown. This system provides a percentage breakdown of enamel versus dentin involvement, which I will talk about later and how it generates revenue for my practice. I find these features very useful for patient education and deciding between preventive measure and restorative measure. Okay, so let's move on to the final part, which I want to show you is how to do printouts. So you can click here, you can select the X-ray that you want to print out, and then you can just click on printout. So essentially, you can customize the printout option, which is helpful for patient handouts, referrals, or insurance claim. When printing, you can select number of images per page, page orientation, specific image to include, and which pathologies to display. So this gets downloaded as in a PDF format, identifying everything that we have discussed. So tartar in green, progressed cavity in dark magenta. In pink, we've got the incipient cavity, yellow bone level. The white is enamel, green is dentin, purple is pulp, blue is cementum, and yellow stroke orange pink is restoration. And you can select the right and the left side, and you can just print it off and provide it to the patient.
Right, guys, so I hope you found that video useful. Now I'm just going to mention you essentially things that we can detect. We can detect anatomical structures such as the ID nerve. We can check the bone level, measure bone, which is quite good for a periodontologist. Then we can talk about root canals. We can talk about fillings, whether it's metal or non-metal, the type, the percentage breakdown, periapical radiolucency. We can talk about cavities, light pink, dark pink, tartar built around, measure root length, and any kind of marginal discrepancies. So how has Pearl built trust? Thanks to Pearl spending a lot of money on second opinion, the software is now able to detect small and big cavities with precision. And that helps us dentists to describe things with confidence to the patient. Moving on, how has Pearl built trust? Thanks to Pearl investing a lot of money in second opinion, the software is now able to detect large or small caries precisely. And due to the precision, us dentists are able to diagnose things with confidence. And if patients sees confidence in their dentist, they are more likely to take up the recommended treatment. Visual annotation. We know a picture is worth 1,000 words. And as human, we believe in what we see rather than what we hear. And Pearl gives that clarity. It empowers patients to make the right decision about their dental health. It empowers them to take up the recommended treatment plan. But above all, it gives them the understanding of why did the problem occur and what they can do in the future to prevent this from happening again. Okay. So how has Pearl made an impact to the practice? As I mentioned, I bought my practice in February 2023. And for the last 24 months, I have invested heavily into the practice to improve our the communication, our patient journey, and overall to give patient an advanced treatment and treatment that the patient can walk out with full confidence in them. Since January last year, I have made it mandatory to all my practitioners, associate dentists, that they have to use Pearl, and we keep a spreadsheet for data collection. What we have noticed is that since we have started doing the data collection, there has been a 48%, made it mandatory, we have seen a 48% increase in the number of patients taking up one or more fillings. And it's out of that 48%, we have found that 75% of these patients are now asking for an upgrade, i.e., they are moving away from an NHS filling and requesting a white filling, which automatically generates revenue for the practice. And one of the reasons is the percentage breakdown. So this is an X-ray of Otis, a patient that has been coming to the practice since he was 7 years old. So he's been coming to the practice for over 20, 30 years. He's 37, I believe now. I saw him for the first time in June 2024. He came for a regular checkup. IT guy by profession, just snacks, usual 3 meals a day, just has a snack in between. No problems, no pain from anywhere, regular checkup. We did the medical history, we went through extra-oral, intraoral assessment, and we took some regular bite wings. On the X-ray, we showed him the colored version through second opinion, and this is what I explained to my usual way. This is your right side, this is your left side, this is your enamel, these green and purple area are your dentin, and these are your nerve, these are your existing fillings. You've got some light pink area, which is fine. With a good oral hygiene, with a good diet, you can stop its progression of the cavity. But unfortunately, you've got some areas which have grown into the green zone, and we recommend some filling. And this is the upper right 5. You need a filling here, you need a filling here, and you need a filling here. Then I hovered over the dark pink areas and showed in the percentage breakdown. And if memory serves me right, this was about 29%, this was about 15, this was about, it was about 20 to 30%. So I said to Otis, you are an NHS patient. By default, we will be giving you a silver filling under a band 2. Okay, you can either go for that or you can upgrade the treatment and you can go for a white filling. A white filling is fee per item. And Otis straight away turned around and said, Dr. Kunal, these are going to be a massive silver filling in my mouth. I'm not happy to have them. I'm happy to go for a white filling. I already have a lot of silver, and because of my job and because of the amount of conversations I have with different clients, I would like to go for a white filling. So we sold something without really selling. This was Miriam. Miriam is a mother of 2. She was an accountant by profession initially. Now she's gone back to university and she is a second-year student, law student. She came to see me. She was a registered patient at the practice. She came to see me with a broken lower right 6, which is this tooth. We went through the normal procedure, medical history check. We went through extra-oral. We did some intraoral assessment. Thereafter, we took some regular X-rays. And on the X-ray, we found a few teeth that needed a filling. And she self-confessed that she has her oral hygiene, her sugar intake has really changed over the time since she's gone back to university. She doesn't really have time for herself. She's spending a lot of time studying and looking after the kids, and the free time that she has, she's literally knackered and she just falls asleep. So the oral hygiene has not been optimal. We decided, due to the financial constraint, we're going to go for a hybrid model. We will do the posterior teeth in silver, and the teeth that come in a front anterior smile area, we're going to do that in white. She also chose for this to be a ceramic private onlay. So this is what we did for her. We did a silver filling here, and thereafter we did some white filling in this area. This was the tooth of concern. We drilled it out, and then we built it back up with Tokuyama, funnily enough, and then we checked functionally to make sure that there was no occlusal trauma. This is a radiographic image of Tamara, a junior doctor at Liverpool Hospital. She lives in Leeds. She came to see me because she was getting some symptoms of reversible pulpitis. We took a PA for her. We showed her the color version and we showed her the percentage breakdown, and it was 79%, 75%, sorry. So I gave her the same options. She chose to go for a white filling. This was the tooth of concern. We can see the restoration is not optimal. There's leak in restoration, and there's caries over here. We drill the tooth out, and we can see there's no nerve exposure. The removal is about approximately 75%, so we can say it's relatively accurate, the percentage breakdown. Then we built it back up again with Tokiyama and a view stain over there. And if I must say myself, the filling looks quite realistic, and we did check the bite to make sure there is no occlusal trauma. Now, guys, don't panic. We are almost to the end. So why Pearl and AI? AI, in my opinion, AI is the future, is the present and the future. Generally, when I speak to the dentist, the main reason they hate to use AI is because they have this fear that AI is going to replace them. But luckily, dentistry is one of those jobs which is safeguarded because AI do not have emotional intelligence, cannot show empathy. If anything, it can make us dentists to perform better by identifying things at a very early stage. Using the radiographic analysis, we can say, okay, this is about 20% into the tooth. Would you like to have a filling? At the same time, it can also empower the patient to make the right decision about their health. It can give them a micro lesson in dentistry. Now, I'm just going to go through a few testimonials from my patients, from my staff, and my associate dentist. So this is Angela, a patient of the practice. She basically said, I love the tooth part feature. It makes it easy to understand what is exactly happening with my teeth. Miriam, whose x-ray I just showed you before and a treatment that we did, she essentially said, I can tell myself now where I need a filling just by looking at the x-ray. And she rightly so pointed out at the left side herself. Colin, bless him, he's been coming to the patient for a very, very long time, even before I was born. And I started seeing him from February 2023. When I showed him Pearl for the first time, this is what he said, and I quote, I have been coming to this practice for over 10 years. Why has no one shown me my x-ray like this? I would have looked after it much better. Bless him. Natai, emergency patient that came to see me with a problem with his lower left 7. We took an x-ray, a PA for him, and we showed him the colored version. And this is what he said. I like the colored version of my x-ray as I can see exactly what you are talking about. Moving on. Now I'm going to talk about my staff. So, as I mentioned, I'm a big advocate of artificial intelligence and digital dentistry. Apart from Pearl, I also use Kuroku for my notes. Currently, my nurse, Kaylee, she does all my notes for me. She doesn't have to type anything, she just have to click buttons. And since we installed Pearl, she can just go on, switch on Pearl. She can know exactly which teeth needs a filling. And she just does my X-ray report for me too. But I just want to make this out clear from the outset that I still go through my notes. I still go through my X-ray to make sure she's done everything correctly. What she says is, I can now do your X-ray report. Go sit in the kitchen, sip onto your coffee and have a biscuit while I'll do your report. But other nurses says we seem to run on time now. And then I've got another one who said it makes it easy for us nurses to check beforehand which tooth we are working on in case we have noted incorrectly on our list. Moving on to dentists. Dr. Namrata, an associate at the practice, basically she said, I love the two-part feature. It makes it easy to explain findings. She also said we can present X-ray findings with confidence. Dr. Aditi mentioned I am no longer missing out things on X-rays, and the comparison feature really helps patients to see progression, which can be a convincing factor in their care decision. Right, so I'd like to open the door for questions. For those of you who would like to schedule a demo, I'm sure Robiha will be happy to help you guys. Please scan onto this QR code and then you can fill in your details.
Thank you so much, Kunal. That was really interesting. I also want to thank FMC for hosting us. Of course, please get your phones out and scan the QR code to book your demos. Right. Hello.